Okay, guys, it's the Nurse Kimy here with you guys. We're going to be going through the musculoskeletal system, and we're going to be doing our version of studying, which is repetition. As you know, in nursing, repetition is key. The majority of the information that we get our nursing content from is from Level Up RN, and we basically use their content, and for study purposes, we repeat the content for signs and symptoms, risk factors, and patient teachings several times. A lot of times when people are teaching, they will just teach and say it one time, and it's your responsibility to do what you need to do to learn the information. That doesn't work well for people that have learning disabilities or that learn differently. So we're going to go ahead and we're going to get started. The musculoskeletal system consists of the bones. It provides structural support, protection of organs, blood cell production, storage of minerals and lipids. There are types of bones: long, short, flat, irregular, sesamoid bones. Long, long, long. Short, short, short. Flat, flat, flat. Irregular, irregular, irregular. Sesamoid bones, sesamoid bones, sesamoid bones. Now we have the joints, areas where two or more bones meet and allow for range of motion. There are types of joints. There are synarthrodial, 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 synarthrosis, 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 which are immovable, amphiarthrodial, 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 which is slightly movable, and diarthrodial, synovial, diarthrodial, synovial, diarthrodial, synovial, which are movable. Then there are skeletal bones, which allow for body movement under voluntary control. Skeletal bones allow for body movement under voluntary control. Skeletal bones allow for body movement under voluntary control. Then there are tendons, fibrous connective tissue that attach muscles to bones. Tendons, fibrous connective tissue that attach muscles to bones. Tendons, fibrous connective tissue which attaches muscles to bones. Ligaments, fibrous connective tissue attach bones to other bones. Ligaments, fibrous connective tissue that attaches bones to other bones. Now we're going to go to bone layers. Outer layer, cortex, dense, compact bone tissue. Outer layer, cortex, dense, compact bone tissue. Outer layer, cortex, dense, compact bone tissue. Inner layer, medullary cavity, spongy, cancellous bone tissue. Medullary cavity, spongy, cancellous bone tissue. Medullary cavity, spongy, cancellous bone tissue. Contains bone marrow where hematopoiesis occurs. So that's hematopoiesis. Then we have long bone components: diaphysis, midsection shafts. Diaphysis, midsection shaft. Diaphysis, midsection shaft. Epiphysis, knob-like end. Epiphysis, knob-like end. epiphysis, knob-like end. Metaphysis, area where the epiphysis meets the diaphysis. Metaphysis, area where the epiphysis meets the diaphysis. Metaphysis, area where the epiphysis meets the diaphysis. It contains the epiphyseal plate. Contains the epiphyseal plate. Contains the epiphyseal plate, which is the growth plate or epiphyseal line. Epiphyseal line. Epiphyseal line. We're going to go on now to bone remodeling, which is continuous process by osteoblasts. Continuous process by osteoblasts. Continuous process by osteoblasts, which is bone-forming cells, and osteoclasts. 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 So remember, osteoclasts and osteoblasts are very important. Osteoclasts are bone-destroying cells. Osteoclasts are bone-destroying cells. After 35, bone reabsorption exceeds bone formation. After 35, bone reabsorption exceeds bone formation. After 35, bone reabsorption exceeds bone formation. Osteoblast equals bone building. Osteoclast is bone crushing. Now we're going to go on to hormones that affect bone growth. Parathyroid hormone, levels of calcium in the blood. Increase levels of calcium in the blood. Increase levels of calcium in the blood. Parathyroid hormones promotes osteoclast activity. Parathyroid hormone promotes osteoclast, which we just learned, activity. Moving calcium from the bone into the bloodstream. Moving calcium from the bone into the bloodstream. Moving calcium from the bone into the bloodstream. Now we're going to go on to calcitonin. Decreased level of calcium in the blood. Decreased level of calcium in the blood. Decreased levels of calcium in the blood. Calcitonin decreases blood resorption by inhibiting osteoclast activity. Calcitonin decreases calcitonin decreases bone reabsorption by inhibiting osteoclast activity. Calcitonin decreases bone resorption by inhibiting osteoclast activity. Opposes the action of PTH. Opposes the action of PTH. Opposes the action of PTH. Calcitonin helps tone down calcium levels in the blood. That is a cool chicken hint. Calcitonin helps tone down calcium levels in the blood. Next, we're going to go on to growth hormones. Regulates bone growth and metabolism. Regulates bone growth and metabolism. Regulates bone growth and metabolism. Stimulates osteoblast activity, promotes bone formation. Stimulates osteoblast activity, promoting bone formation. Stimulates osteoblast activity, promoting bone formation. And then we have cortisol. Small amounts are needed for bone development, but large amounts block bone growth. Small amounts are needed for bone development, but large amounts block bone growth. Small amounts are needed for bone development, but large amounts block bone growth. Glucocorticoids cause bone loss due to decreased bone formation and increased bone breakdown. Glucocorticoids can cause bone loss due to decreased bone formation and increase bone breakdown. Glucocorticoids can cause bone loss due to decreased bone formation and increased bone breakdown. We're now going to go on to synovial joints. Joint capsule surrounds a synovial joint composed of fibrous connective tissue. Surrounds a synovial joint composed of fibrous connective tissue. Surrounds a synovial joint composed of fibrous connective tissue. Synovium, membrane that lines the joint capsule and secretes synovial fluid. Membrane that lines the joint capsule and secretes synovial fluid. Membrane that lines the joint capsule and secretes synovial fluid. Provides lubrication and shock absorption. Provides lubrication, shock reabsorption. Provides lubrication, shock reabsorption. The next one we have here is joint cavity. Fluid-filled space where articulating surfaces of the bones contact each other. Fluid-filled space where articulating surfaces of the bones contact each other. Fluid-filled space where articulating surfaces of the bones contact each other. Articular cartilage, thin layer of hyaline cartilage that covers the surface of each bone. Thin layer of hyaline cartilage that covers the surface of each bone. Thin layer of hyaline cartilage that covers the surface of each bone, where it articulates with other bones. Where it articulates with other bones. Where it articulates with other bones. And then last, we have the bursae, which is a small fluid-filled sacs lined with a synovial membrane. Small fluid-filled sacs lined with synovial membranes. Small fluid-filled sacs lined with synovial membrane. It prevents friction between the bone and other structures. It prevents friction between the bone and other structures. Next, we're going to go on to musculoskeletal diagnostic test. Arthrocentesis, aspiration of synovial fluid from a joint cavity and or injection of medications. Aspiration of synovial fluid from a joint cavity and or injection of medications. Aspiration of synovial fluids from a joint cavity and or injection of medications. And now we have an arthroscopy. Provides visualization of the internal structure of the joint. Provides visualization of the internal structures of a joint. Provides visualization of the internal structures of a joint. It allows for collection of biopsies and surgical repair of joint structures. It allows for the collection of biopsies and surgical repair of joint structures. It allows for the collection of biopsies and surgical repair of joint structures. Contradictions, infected joint, lack of joint mobility. Contradictions: infected joint, lack of joint mobility. Contradictions: infected joint, lack of joint mobility. Dual X-ray absorptiometry, DXA, measures bone mass used to diagnose osteoporosis. Measures bone mass used to diagnose osteoporosis. Measures bone mass used to diagnose osteoporosis. And then we have a nuclear medicine scan used to identify fractures, infections, bone cancer. Used to identify fractures, infections, bone cancer. Used to identify fractures, infections, bone cancer. Isotope administered 4 to 6 hours prior to the procedure. Isotope administered 4 to 6 hours prior to the procedure. Isotope administered 4 to 6 hours prior to the procedure. Scan may be repeated at 24, 48, and 72 hours. Scan may be repeated at 24, 48, and 72 hours. Scan may be repeated at 24, 48, and 72 hours. Patients should increase fluid intake after procedure. Patient should increase intake fluid after procedure. Patient should increase fluid intake after procedure. The next one we have is a electromyography, an EMG, used to evaluate muscle nerve disorders. Used to evaluate muscle nerve disorders. Used to evaluate muscle nerve disorders. Needles inserted into the muscle and electrical activity is recorded. Needles inserted into the muscle and electrical activity is recorded. Needles is inserted into the muscles and electrical activity is recorded. Now we're going to go on to osteoarthritis. Progressive degeneration of cartilage in a joint. Risk factors: older female. Older female. Older female. Obesity and smoking. Obesity and smoking. Obesity and smoking. Repetitive stress on the joints. Repetitive stress on the joints. Repetitive stress on the joints. Signs and symptoms: joint stiffness. Joint stiffness. Joint stiffness. Increased pain with activity, decreased pain with rest. Increased pain with activity, decreased pain with rest. Increased pain with activity, decreased pain with rest. Enlarged joints. Enlarged joints. Enlarged joints. Crepitus. 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 Loss of function. Loss of function. Loss of function. Herberdin's nodes. Herberdin's nodes. This is important. Herberdin's nodes. Herberdin's nodes. Bouchard's nodes. Important. Bouchard's nodes. Bouchard's nodes, which is, here's a cool chicken tip. Herberdin's are higher up on the finger. Bouchard's are below. The next one we're going to go on to now is osteoarthritis. And the patient teaching for osteoarthritis: balance rest with activity. Balance rest with activity. Balance rest with activity. Lose weight and stop smoking. Lose weight and stop smoking. Lose weight and stop smoking. Engage in physical therapy. Engage in physical therapy. Engage in physical therapy. Engage in strength training, yoga, or Tai Chi. Engage in strength training, yoga, or Tai Chi. Engage in strength training, yoga, and Tai Chi. Apply ice for acute inflammation. Apply ice for acute inflammation. Apply ice for acute inflammation. Apply heat for stiffness. Apply heat for stiffness. Apply heat for stiffness. Utilize splinting assistive devices. Utilize splinting assistive devices. Utilize splinting assistive devices. The next one we're going to go on to is rheumatoid arthritis, which is a chronic progressive autoimmune disease that causes inflammation, thickening, and deformation of the joints, bilaterally and systemically, categorized by periods of exacerbation and remissions. So key factors here: autoimmune disease, bilaterally and symmetrically. Okay, it's an autoimmune disease, which you must know, bilaterally and symmetrically. Risk factors: female, age 20 to 50. Female, age 20 to 50. Female, age 20 to 50. Family history. Family history. Family history. Signs and symptoms. Again, important: bilateral, joint pain and swelling. Bilateral, joint pain and swelling. Bilateral, joint pain and swelling. Morning stiffness. Morning stiffness. Morning stiffness. It increases pain with rest, decreases pain with activity. Increases pain with rest, decreases pain with activity. Ankylosis. 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 It's a joint fixation and deformity. Fatigue. 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 Another important one: swan neck and boutonniere deformities. Swan neck and boutonniere deformities. Swan neck and boutonniere deformities. Ulnar deviation. Ulnar deviation. Ulnar deviation. Subcutaneous nodules. Subcutaneous nodules. Subcutaneous nodules. Fever. 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 Red sclera. Red sclera. Red sclera. Lymphadenopathy. 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 And that's it for rheumatoid arthritis. We'll be back. We'll go on to the next set.